In the previous episode, in the discussion of muscle cramp during dialysis, we have seen why it occurs and what are all the causes of muscle cramp during dialysis. In this episode, we are going to discuss how to manage that muscle cramp, because muscle cramp is a serious problem, at least considering the quality of life and the pain the patient undergo because of the cramp. It's a significant problem. So how to manage it? For the management, we can divide the condition into two. First, a patient who are presenting for the first time with cramps, and those who are having recurrent muscle cramps during dialysis, especially in a maintenance hemodialysis patient. First, the patient who had this cramp for the first time, the treatment is many a times you give normal saline, usually the cramps intensity will come down and the severity or frequency will also come down. As I told, hypovolemia or excessive ultrafiltrate rate is the most common cause clinically. So we are replacing the fluid by giving normal saline. 0.9% saline is more than enough to treat this muscle cramps. And also you have to reduce the ultrafiltrate rate. Ultrafiltrate rate above 13 ml per kg per hour. This is a theoretical calculation. On an approximate basis, we can say more than 600 ml per hour. If we remove, the patient is prone to develop this cramp. So you have to reduce the ultrafiltrate rate. So the weight gain, we have to advise the patient to take a limited fluid, taking into consideration the urine output also and the diuretic dose also. Many parameters plays a role here. We can't just reduce the fluid rate. Patient might develop shortness of breath. So if we are reducing the ultrafiltrate rate, that is the water removed per hour, if we are reducing from, for example, 1 liter to 500 ml, so that much amount of water can be removed by extending the duration of the dialysis. I hope you might have got confused enough. Let me give you an example. For example, a patient gained around 2.5 liter of water, and the duration of dialysis, for example, let us take it as 3 hours, or let us take ultrafiltrate as 3 liter. We want to remove 3 liter in a patient in the duration of 3-hour dialysis. So what is the ultrafiltrate per hour? Is 1 liter. Suppose a patient is developing cramps, we have to extend it to probably 5 hours so that the net ultrafiltrate will remain the 3 liter over 5 hours. So every hour the amount of fluid removed will be reduced. So the values I am just saying for example. Don't go into the confusion why 3 hours, why 3 liter and all. Just an example to say the ultrafiltrate rate. What is the rate? The time with which fluid is removed per hour. We are going to reduce it below probably 500 ml per hour. So ultrafiltrate rate have to be reduced. If the patient develop cramps, better stop the ultrafiltrate for some time. So this is the first step. So if the patient didn't respond to saline, what to do next? Many times a short gap of dialysis required. We have to remove the needle if the patient is in fistula or catheter is connected. Remove from the dialysis from the patient the tubing. You put it into circulation. Give few minutes rest if the cramps is very severe. This is another thing you can do practically. And the third one is many times hypertonic saline. Hypertonic saline or mannitol might be helpful. 3% NS might be helpful. Mannitol is risky because it might get accumulated in the body if the patient urine output is very less. So this we have to take into consideration overall patient urine output and will we tolerate mannitol or not. So first normal saline. The second you can consider hypertonic saline or mannitol. Before that, stop the ultrafiltrate or reduce the rate. Volume replacement is required. This is the first step. Second one, if hypotension is there, we have to treat the hypotension. If the patient have taken antihypertensive medication, you can instruct them not to take before the dialysis so that the BP won't fall during dialysis, so that cramps won't occur. These are all the two important steps in a patient first time developing the cramps. What to do if the patient is developing cramps on every dialysis? So here, as I told, the cause, what are all the causes of the cramps that have to be evaluated? Patient calcium, magnesium have to be checked and it have to be replaced. Apart from that, you have to check the dialysate sodium. Probably a higher level of dialysate sodium might be required. In the dialysate, in the machine monitor, you can adjust the sodium level. Probably a higher level of sodium might be required. Yes, this will bring the BP up also. That we will call as sodium modeling. As per the patient sodium and patient symptom, we are going to adjust in the dialysate. Probably a sequential rise in sodium over 4 hours might be required, which is called sodium modeling. The nomenclature might look unfamiliar to you. It is nothing but adjusting the sodium over the duration of dialysis. Sodium modeling also we are going to discuss it separately, but currently remember, sodium modeling means adjusting the sodium level during the dialysis at a sequential level. A probably higher sodium you might have to keep. This is the first point with respect to the recurrent cramps. And another one is carnitine deficiency. If the patient is malnourished and the patient is not having enough amount of carnitine, then also this cramps is common. Carnitine replacement might be required. Magnesium supplementation if magnesium level is low. Calcium supplementation if calcium level is low. Probably patient hypoglycemia should also be taken care of. If after managing all this, what are the things I have told? Hypovolemia, excessive ultrafiltrate rate, sodium, calcium, magnesium, carnitine deficiency. If after doing all this still the patient develops cramps, then probably you have to replace vitamin E, biotin, these kind of supplementation you can try, because we have treated or searched for the most common thing which is causing cramps. Now we have to supplement with biotin or vitamin E. Apart from this, any other treatment is available. Mostly 99% patient will respond to this. Whenever you are altering the ultrafiltrate, you have to take other things into consideration. Patient urine output, diuretic dose, how much water gain he is achieving, or how much water gain he have achieved between two dialysis, frequency of dialysis. All these are interlinked parameters. If one is adjusted, other have to be taken into consideration. So this is a general outline regarding treatment of muscle cramps during dialysis. In summary, always look for volume depletion, reduce the ultrafiltrate rate, replace saline or hypertonic saline, adjust the sodium, replace calcium, replace magnesium if it is deficient, carnitine, biotin, vitamin E might be required, and always check for malnutrition. A chronic malnutrition have to be replaced in the dialysis undergoing patient so that cramps won't occur in recurrent situations. So this completes the discussion on muscle cramp treatment. In the next episode, we will see regarding management of hypertension during dialysis. Bye-bye.